Well, one of the systems of government not closed by the shutdown is the VA Maryland healthcare system. And joining us live this morning with more information is Dr. Dhruv Gadhia. Good morning.
Good morning, Jen.
Well, okay, so you guys are open for business.
Yes, we want to reassure all of our patients, our veterans, their families, and their caregivers that we are open and we're seeing patients and serving them.
That's really good news. I'm sure there have been a lot of people concerned about that. So let's talk about some of the services you provide for veterans.
Absolutely. We have a full range of services. We have primary care, specialty care, social work, mental health, and just a whole host of other things to help us serve our patients.
And sometimes I know there can be a lot of confusion, especially among older veterans, on how to get the care that they need. So what kind of advice do you give them?
Well, I think the most important thing is we want you to apply for care. You know, folks may not know that they may be eligible, so please do apply. And we can serve our older veterans through various ways, whether it's preventive services, thinking about this time of year, flu shots are going to be super important. We'd like to help veterans protect their health, but also other services, that whether it's cancer screenings or whether it's prosthetics or even like physical therapy to help prevent falls and recuperate after having any sorts of injuries this time. And we encourage everyone, of course, to be safe in the snow.
What are some of the services that people and veterans would be surprised to know that you do offer?
Well, I think the biggest thing is that we are very comprehensive. Whether it's thinking about nutritional counseling, whether it's thinking about social work, and even helping with our homeless veterans in housing. We were able to help our veterans in many different ways, and I think it's just I'm really proud to be a part of a system that's very comprehensive and very broad in its scope in serving our veterans.
You have a new outpatient clinic that's opening.
Yes, we're very excited to talk about that. We hope to open that in the next month, and it's going to be in Rosedale, and it's going to be state-of-the-art, providing primary care, mental health, social work, and other services to our veterans.
That's awesome. We were talking a little bit off camera about how the VA system is still very much old school and that they're working to sort of modernize.
Yes, we are definitely, a modernization effort is in progress. We're looking forward to our new electronic medical record that will be coming. I think there's been a lot of work being done to get us up to speed there. But with that said, though, a lot of the things that the VA does are already state of the art. The VA has actually pioneered a lot of the devices and some of the innovations that are out there, whether it's prosthetics items or even the artificial heart. We're very proud of the innovations that have already occurred at the VA.
And tell us again when your outpatient clinic's going to be opening?
Well, we're putting the final touches on the clinic, and we're hoping to open up next month, and we look forward to all of our veterans applying and seeing them there.
All right, Doctor, thank you so much for coming in.